In less than an hour, Robin Roderick got what she had long wanted, a medical tattoo.
Oh, look, it's beautiful.
The new permanent medical ID states her health condition, which is called congenital adrenal hyperplasia.
They won't mistake that at the hospital.
It really means your adrenal glands don't function. I take steroids daily, and then if I have an adrenal crisis, then it becomes very life-threatening.
That's why she always wore a medical alert bracelet. Now she's replaced that piece of jewelry with a tattoo.
Yep, that's what I want.
Tattoo artist Jeffrey Grimmett, owner of Inner Soul Inc. tattoo salon in Mount Airy, Maryland, says the pre-session discussion with the customers is the most important part of the tattooing process.
So I can physically see what they're actually have in their head. That way I can actually, take that and actually apply it to the design.
It has to be above that right there.
He also leaves it to his customers to decide where to place the tattoo. But he says it should be in an accessible place on the body so medical professionals can see it in case of an emergency.
Probably somewhere around the wrist or wrist area. So when they go to take a pulse, then they see it immediately.
That's exactly where Ryan Merchant decided to put his tattoo more than a year ago. It was his 5th tattoo. Merchant was diagnosed with diabetes when he was 13 years old. As an electrician, he finds a tattoo more practical and safer than the metal alert bracelet he used to wear.
Don't want to wear metal when you're working with electricity, so I would always have to take it off before a shift.
Tattooing is minor surgery, so patients should discuss it first with their doctors. Endocrinologist Dr. Salah Al-Dosuki told VOA in a Skype interview.
If not done right, if not done by licensed parlors and by clean and sterile tools, then patients can have infections.
Dr. Al-Dosuki says the medical community needs to come up with some guidelines to standardize the process. But he says more of his patients are getting medical tattoos and are happy with them.
We can certainly call it a growing trend amongst patients, in particular with diabetes.
Tattoo artist Jeffrey Grimmett also sees more people coming to his salon asking for medical tattoos.
And I would say probably maybe 60 to 80 a year.
Grimmett says this new trend is good for his business, and he expects it to grow. For producer Faiza Elmasry, I'm Carol Pearson, VOA News.